This lady is coming from Sweden. She has chronic cystitis. When we look at urethra is normal. Sometimes we have concerns about the urethra. It is normal. There is no problem in urethra. When we look at the trigone, these are abnormal patchy tissues over the trigone. When I can see it comes still here. These are patchy abnormal areas, and there are some leukoplakia islets, islands, small leukoplakia tissues, but usually it's a trigonitis. We have to say patchy abnormal tissues. These are not normal tissue. What is normal bladder tissue? Normal bladder tissue must be like this. This is a normal mucosa with normal vessels, blood vessels, but here you can see the patchy appearance of mucosa, very really changed tissues, abnormal tissues. And the most important property of urinary bladder epithelium, it has to be impermeable to acid of the urine. So acid cannot touch to this bladder wall. It cannot give any disturbance to this bladder wall. But here, the acid, urinary acid, touches into this bladder wall and it gives irritation, disturbance every time, and pain, and frequency and urgency. So when I look into urethra, here is urethra. Urethra, it's not very common to have a chronic infection in urethra. Also, if it has some, it will heal with antibiotics in my theory. But here, the tissue change in some ladies never heals with normal antibiotic treatments. Chronic use of antibiotics makes the bacteria stay away from this tissue, but they cannot heal this tissue, at least in some ladies. When I look the rest of mucosa, the rest of the bladder, maybe she has some difficulty in urination. There are some muscle bundles prominent here, hypertrophied, and the rest. So for sure, it's very obvious she has no interstitial cystitis because the bladder capacity is normal. Sometimes when we begin to empty bladder, patchy hemorrhages may be observed. Now I am emptying the bladder and observing if there is any hemorrhage. The hemorrhages usually happens in the lateral bladder walls, in this part of bladder. Till now there is no problem. And why don't other urologists see nothing in these bladders? Look, when I look like this, when I come from urethra, if I don't arrange my focus, adjust my focus very well, when I go inside, look inside, and quick look to ureteric orifices like this, I may not understand the problem here. No, it's always obvious to me there is problems for sure. But when you adjust your focus a little bit better, like this, it's very prominent. Those ladies had many times cystoscopies, and urology doctors do not accept these tissues as abnormal. They accept this to be trigonitis, and they say it is treatable with antibiotics. But for sure, this lady used a lot of antibiotics and she didn't heal. So, bladder is normal, there is no interstitial cystitis findings. Now we will make fulguration of these tissues. Doğru değil mi? Biraz daha yaparsınız şöyle.
Please.
So, I changed my instrument to plasmagnetic cautery, and I am now marking the borders of the abnormal tissues. This is ureteric orifice. These are normal tissues, although there is a bleeding here. Okay, this is marking line. And these are, I make marks. Maybe here I have to be a little more wider. This is healthy tissue. This is healthy. Here is healthy. It's a little suspicious, so I will go further. Oh, look, here is an islet of leukoplakia. I don't like this red area, so I will perform fulguration here. Okay, I think maybe there is a little wider. It's important to choose the right side, right place, mark the necessary part. If you make too much wider fulguration, the recovery will be too long. If you mark very less, you mark the fulguration less, then the healing will not be enough. So we have to mark the right places. And look, these tissues are abnormal patchy tissues. These are not normal bladder mucosa compared to this one. This is a good bladder mucosa. This is a Trigonitis area. Sure, so she had used many antibiotics for long term, and the superficial superficial leukoplakia tissues are healed mostly. There are some remnants of leukoplakia, but mostly she has Trigonitis. Okay, let's begin. Wait. I begin in the widest part. In Trigonitis, actually, I want to fulgurate a little deeper because the resistant, maybe there is bacteria or not, but resistant tissues, maybe a little more. So now I'm making it superficial, but now I will go a little deeper. So I am fulgurating the tissues. If I have some suspicion, I am making, like these parts, longer fulguration, and it makes the effect deeper. If I stay here a longer time, it has a deeper effect. In some parts, for example here, there are not too much abnormal tissue, so I don't need to make it deeper. Just the superficial fulguration for the tissue to recover itself, to let the new tissues grow over the abnormal tissues. Then I clean the tissue remnants. Still there is a little, look, this is a normal, this part is red. It usually doesn't go beyond trigone, which is this place. Here are healthy tissues. This lady is having the infections till her childhood ages. Like 1 year, 1.5 years, she is having these troubles. So her tissues, her problem is a little wider than I expected. And the superficial leukoplakia part was absent. It was healed by antibiotics. She has resistance to many antibiotics, so they are really in trouble. This is urethra. I will have to define a border in the urethra, not come to inside the urethra. Yes, it seems nice. This is sphincter of the urinary bladder, which holds the urine. And now the tissues are looking healthy to me. It's nice. I am making a little deeper fulguration. It may lengthen the recovery time, but she is brave. She will stand. I want to totally heal the problem. Okay, it seems quite good to me. These are ureteric orifices, one in each side. Now it looks healthy for me. Now, the last part of our operation is looking into vagina. Yes, we are finished. Let's have a look, last look. All new bladder mucosa will grow over this fulgurated area. Some people say, can you harm our bladder? Can you give harm? Can you make a hole in the bladder? No. We make 2 deep resections in bladder cancer cases. This is very superficial. Only 1-2 millimeter in deepness. If it was a cancer, we will make a very deep, like this loop, my instrument length. We will go deeper. So let's move into vagina. This is vagina. Here are some discharges, which are not so much. I can't say this is a very infected vagina. These seems normal. This is the opening of cervix uteri. And when I look to opening, okay, there are some tissue changes, not extreme, but still there are some tissue abnormalities. It's a little more than normal. It's inside the uterus. We can see the inner part of uterus. I don't want to push too much water inside uterus, but here, this is a normal cervical tissue, but here there is some dysplasia. These are the main cause of vaginal discharge, and it is the main cause of our infection. So, this is the opening of cervix. Here, I don't treat these tissues simultaneously with my operation because it gives a lot of difficulty in the healing period. Maybe in the future I can resect these tissues too, but this is the duty of gynecological colleagues, and I will send this video for their consultation. Really, it's not a big issue. It can be done under local anesthesia in the office space. It doesn't need too much general anesthesia or something like this, so it has to be done later. I don't want simultaneous procedure.